So we're doing chapters 20 and 21, which are the lymphatic and the immune system. First off, functions of the lymph system is going to be to return excess fluid and interstitial space to the blood system and to help and assist in providing immunity. The organs we're going to talk about are our lymphatic vessels, the lymph nodes, the tonsils, the thymus, the Peyer's patches, and the spleen. So first off, our lymph vessels are going to be similar. They're going to be kind of a similar to our veins, and they're going to be low pressure, and they'll actually be very, very leaky. So basically what's going to happen with our lymph vessels is we're going to have lymph capillaries wrapped around the capillary beds in our tissues, and they will be there to soak up any extra fluid in the area. Along our lymph vessels, so here's our lymph vessels, then we get lymph nodes. Okay, within our lymph vessels we're going to have valves. They'll be one-way valves, so fluid could travel towards the heart, but it can't back up. Since it can't back up, you can't get pooling of the fluid. It'll just keep moving towards the heart. Then we have our lymph vessels, our lymph valves, our lymph nodes, then we'll get the lymph trunks and the lymphatic ducts. This is just some simple anatomy here. This is the thoracic duct. It will drain into the left side at the junction of your left jugular trunk and left subclavian vein. It drains right at their junction. It's the entrance of the thoracic duct. This is going to be your left subclavian trunk. Okay, this is your left bronchomediastinal trunk. Here we'll have our right bronchomediastinal trunk, right subclavian trunk, and right jugular trunk. These guys all come together to form the right lymphatic duct. Right lymphatic duct will drain right here, which is the junction of the right subclavian vein and the right internal jugular vein. With our lymphoid cells, we'll have our lymphocytes, which are T cells and B cells, our macrophage, which will be there for a kind of like a first line of defense, and they'll have a role in activating T cells. Our dendritic cells, which will also be there as phagocytes, which means they're going to eat other cells, and they'll have a large role in activating T cells. And then reticular cells, they're there just for support. They're there to help everything out. So with our lymphatic vessels, they're going to have lymph fluid within them. They're going to contain large numbers of lymphocytes and macrophage, and they're going to filter lymph. So let's go back a couple. Let's go to this next slide here. So let's say that you have a bruise and you hurt your wrist and it's inflamed. So you have extra fluid in here. So we soak up all the extra fluid and we bring it to the lymph nodes. What the lymph nodes do now is they're going to be skewering and scanning that fluid to make sure there's no foreign invaders or microorganisms. If they are, then they can mount an immune response. And then what they do is they start making the immune cells. They travel through the lymph vessels into the lymph ducts, all right, and then they can dump into the bloodstream right there, where they enter at the junction of the internal jugular and subclavian. They get into the bloodstream. Now we can have some sort of immune response going on throughout the blood. Alright, so the different groupings of lymph nodes I'm going to want you guys to know will be the cervical lymph nodes, the axillary lymph nodes, the inguinal lymph nodes, and I also want you to know the cisterna chyli. We are looking at a single lymph node here. So you notice we have our lymph vessel coming in, we have afferent vessels entering it, and efferent vessels exiting it. They'll all have valves to prevent backflow. So our lymph fluid comes in here, and there's going to be trabeculae to kind of spread it out, which are these little lines here, and inside of the lines would be a little sinus. And within those sinuses we'll find our little nodules of cells here. Alright, and what will happen is lymph fluid passes through here. There's going to be macrophage and T cells in here, and they're just going to be scanning and filtering the fluid to make sure there's no junk in there. If there is, they'll start an attack system, and you could start your immune response. This area right here is called the hilum of the lymph node. A hilar region, or the hilum of any organ, is going to be like the main entrance point for stuff. So blood vessels, nerves. In this case, it's not going to have its main lymphatic because it's actually a lymph node, but there'd also be a lymph entrance for most other organs too. Okay, so our lymph vessels, they'll have lymphatic fluid in them. Lymph nodes, they're going to filter the lymph. They'll have lots of lymphocytes and macrophage in them. Our tonsils, we have palatine, lingual, pharyngeal, and tubal tonsils. You get Peyer's patches. Here, I'll show you this. So we have our tonsils. You have your thymus. They're going to have it's going to play a role in activating T cells. It's very, very large in youth. It grows from an infant until a youth, and then it starts to break down. By the time you are in your like 70s or so, it can be microscopic. So it gets smaller and smaller. Here's the spleen, which is kind of like a super huge lymph node. It'll be there to be filtering blood. And then we have our Peyer's patches. Peyer's patches will be lymphatic tissue found throughout the small intestines. And then you have your appendix, which is once again lymphatic tissue hanging off of the large intestines. Now into the immune system. So there's going to be two major categories, your innate defense and your adaptive defense. Innate defense is you are born with this. It's an innate ability. It's broken up into your first and second line of defenses. Your first line of defense is your surface barriers, basically skin and mucous membranes. Your second line of defense is going to be internal defense mechanisms, such as phagocytes like macrophage. You can have a fever, and that just makes it hard for everything to live that is a foreign invader. You have natural killer cells, antimicrobial proteins, and inflammation. If whatever is invading your body gets through your first and second line of defense, then the third line, or your adaptive immunity, kicks in. That means that this is adapting to whatever microorganism has invaded your body, and it is going to form a specific plan and antibodies to fight that off. There's humoral mediated immunity and cell mediated immunity. Humoral mediated immunity, another name for it is antibody mediated. With our innate non-specific defenses, like we said, first line of defense and second line of defense. So with our first line of defense, we have our surface barriers. So your intact skin. It's just a mechanical barrier. It's something that if you put water on your skin, it doesn't just get absorbed, it beads up and it sits there. So bacteria and germs aren't going to be able to get through there. They can actually live on there. Also on your skin, we're going to have an acid mantle, which your skin will, which your perspiration and sebum and stuff, it makes this a little bit of an acidic environment, and it helps to inhibit bacterial growth. And then you have keratin, which is going to be resistant against the acids, the alkalis, and bacterial enzymes. So it kind of protects you so the bacteria cannot penetrate through your skin. With your mucous membranes, such as your eyes, your mouth, your nasal cavity, vagina, stuff like that, they're going to have some special protective mechanisms. All right. First off, there will be a mechanical barrier, and then you'll have a mucus barrier within the respiratory and digestive tracts. That mucus barrier acts just as like a protective layer within the respiratory tract. I think of it almost like one of those like fly traps that hang you'd see it like in an old barn or something, like a piece of double-sided sticky tape and all the flies get stuck in it. So the microorganisms get stuck in there, and then they can't enter the body. Nasal hairs, they'll act similarly. Cilia, they will be there to propel debris and mucus out of the lower respiratory tract, so you can cough it up and swallow it. If you swallow it, it goes into your stomach, and it gets killed off right here by the hydrochloric acids in your gastric juice. The acid mantle of the vagina is going to inhibit the growth of pretty much most bacteria and fungi in the female reproductive tract. Lacrimal secretions within your eyes, you produce tears, and within them there's going to be lysozyme, and it's going to be an enzyme that will kill off many, many microorganisms. And then urine. Your urine's typically acidic. Most bacteria don't like to live in an acidic environment, so since the urine's acidic, that's going to be its method of cleansing the lower urinary tract. With our second lines of defense, we have our phagocytes, our natural killer cells, our inflammatory response, antimicrobials, proteins, and our fever. So phagocytes are just going to literally eat other pathogens that breach the surface that breach your surface membrane. So they come in, it sees it, it will eat it. We'll talk about the exact process of phagocytosis. Natural killer cells, if they see a microorganism that doesn't belong in your body, they go talk to it and basically tell it to kill itself. Inflammatory response, what it's going to do is it's going to wall off an area and prevent the spread of microorganisms to adjacent tissues. And then it'll also be there to get rid of pathogens and dead tissue cells. So it's just going to be there if you get an infection or an injury to an area to wall it off and make sure none of the microorganisms that got into your body spread. Antimicrobial proteins such as interferon and complement. Interferon is going to be released by virally infected cells and some lymphocytes, and it's going to help start an immune response. Complement is going to kill microorganisms, and it's going to increase the amount of phagocytosis by opsonization. We'll talk about that a little bit later. And then last is fever. When you get a fever, your body temperature rises. As your body temperature rises, it slightly alters the shape of hemoglobin. Hemoglobin won't carry oxygen as readily, and that is going to make it harder for stuff to survive in your body. You feel sick and you feel like garbage, but the bacteria or the foreign invader in your body all of a sudden is having a hard time surviving, so your body can get rid of it at a weakened state. So phagocytosis, here's our microbe, this blue thing. This big purple blob is a macrophage or phagocyte. So the phagocyte would adhere to the microbe. It will form a pseudopod. It will wrap itself around the microbe, and it will be in a vesicle inside the macrophage. Then we have lysosomes that have hydrolase enzymes, and it will literally just kill the microbe. Once the microbe is killed, it gets spit out the other side. A step that's missing here in macrophage and dendritic cells that would occur is antigens on the surface of the microbe would be preserved, and the macrophage would take it and put those antigens on its surface, and it will be called an antigen presenting cell. Then it can go around and tell helper T cells, hey, look what I found. Go tell all the other cells in the immune system, time to find this and kick its butt. With inflammation, so here's just what happens. You get tissue injury. When you get tissue injury, you're going to release chemical mediators like histamine, complement, kinins, prostaglandins. Those are going to cause vasodilation of arterioles, which causes localized hyperemia, which is increased blood flow, which will cause heat and redness. Heat will increase the temperature and metabolic rate of the cells. That's going to help with healing. The increased blood flow is also going to increase the amount of oxygen and nutrients, which will assist in healing. Next, we get increased capillary permeability. Your capillaries leak fluid, and when they leak the fluid, you have protein-rich fluid in the interstitial spaces, which causes pain and swelling. What that does is that will immobilize the area temporarily to promote healing. Kind of like if you jam your finger, it swells up and you can't move it at first. It's your body's response bracing an area saying, hey dummy, you just hurt this. Don't use it for a little bit. Let it heal. Also, with the increased capillaries leaking fluid, you'll have proteins, and those are going to help to wall off and form a clot and form a temporary fibrin patch. So if there's any microorganisms in the area, we can get rid of them and once again promote healing. We'll attract neutrophils via positive chemotaxis to the area, and that'll cause margination. I'm going to start up here before we go down there. We'll release leukocytosis inducing factor, which cause leukocytosis, and then we get migration towards the injured area. As the white blood cells migrate towards the injured area, margination occurs, then diapedesis occurs, then phagocytosis of the pathogens or microorganisms can occur, and we can clean up the dead tissue and get rid of any extra debris and allow for healing. Here's margination and diapedesis we talked about in the last lecture too. So we have a white blood cell floating around. We have we have migration towards this area occurring, and this white blood cell wants to leave the blood vessel and get to the site of injury. So what it does is it undergoes margination. It starts going against the wall of the blood vessel and it flattens itself against the wall of the blood vessel. We're in a capillary bed, so what this can do now is this can kind of weasel its way between two cells or through the wall of the capillary bed and leave. That process of weaseling its way out of the blood vessel is called diapedesis. Then we're going to have positive chemotaxis, so this is going to follow a chemical trail to the area of injury so we can clean up any pathogens or microorganisms in the area. Finally, we have our adaptive immune response, our third line of defense. It'll have two types: humoral, aka antibody-mediated immunity, which will be done through the secretion of antibodies from our B cells, and our cell-mediated immunity, which is going to be done with our T cells. All right, well, we can have helper T cells, cytotoxic and suppressor cells are the ones we will be talking about. The main function of helper T cells is going to be binding to an antigen presenting cell and then finding B cells or macrophage or cytotoxic T cells and activating them via cytokinins. So they'll activate other immune cells. All right. So with our adaptive immunity, it is specific, it is systemic, and it has memory. That means that if you get infected with a specific virus, your body fights it off, and it makes antibodies to only fight that virus. It will be systemic, so it is throughout your whole body, and your body will also keep a memory on that. What does that mean? That if you get that infection the first time you get it, if you get infected by a virus first time you get it, you're sick for a little bit. It takes your body some time to make a factory to build a response to kill off this virus. You get infected with that virus a second time, suddenly your body already has a factory built. Now it sees that virus, the factory's in place, it can just pump out antibodies like crazy and fight off the virus before you even really get sick. Alright, so here's our primary response. We're looking at B cells here. So I have naive B cells floating around. I have a foreign antigen or a pathogen enter my body. That pathogen encounters a B cell that has antibodies that interact with it. What that does is that activates my B cell. What does it do? It clones itself. Once it clones itself, it can continue cloning, or it can differentiate into a plasma cell or a memory B cell. Plasma cells will produce antibodies. Memory B cells will be saved for later in case you get infected again. So do you notice this would be like your primary response up here? All right, with your primary response, you just get a couple plasma cells, you get a small immune response, and you get enough antibodies made so you can fight off whatever's going on. And you also make some memory cells, so if you get infected again, your body knows what's going on. So let's say you get infected again now. Second time you get infected, your body has the memory cells that's got the machinery and the mechanics and blueprints in place to make plasma cells to make the proper antibodies. So you get infected and boom, you have a huge immune response. You make tons and tons of plasma cells. And those guys are all going to make tons and tons of antibodies. So you're going to be able to fight the infection much quicker and much more efficiently. And also, you're going to continue to make more memory cells in case you get infected again. So here it is. Let's say you get infected with, I don't know, with a cold on day 0. Day 0, you get infected, you have no symptoms. It takes 4, 5, 6 days before your body even realizes that you have you've been compromised and you have pathogens inside of you. Then a couple days later, you get some sort of immune response that's small, and you get better. All right. So we had our immune response, and those cells start to die off, or those extra antibodies start to die off. Now, let's say like a month later, you get infected with that same virus again. Well, we had those memory B cells in place. Since we have those memory B cells in place, and actually we have memory T cells too, boom, you just have a huge second immune response, secondary response. Your body has all the pieces to the puzzle. It knows how to fight this off, and it can just kill it immediately. You barely even get sick from it. Okay, so here's another way this works. We said our B cells can come in contact with a specific pathogen, and that pathogen can activate the B cell to clone. Another thing that can happen is our pathogen can get phagocytosed by a macrophage. The macrophage eats it and digests it, and it saves its antigen. It takes the antigen and it presents it on the outside, on its cell surface. It uses that antigen to activate helper T cells and say, hey, this is the antigen this is a pathogen that has entered our body. This is what the microorganism looks like. Go activate some B cells and other T cells and get them fighting against this. So our T cell has been activated. It goes over, it finds like B cells, it sprays them with cytokinins. So here's the B cell getting sprayed with cytokinins, and it causes it to proliferate. As it proliferates, it forms plasma cells and it forms memory cells. So what happens? B cell activation, T cell activation. With B cells, antigen-bearing agent enters your tissue. A B cell encounters that antigen that fits into its receptor. Either alone or often in conjunction with a helper T cell, the B cell will be activated. The B cell will proliferate and enlarging its clone. Some of the newly formed B cells will differentiate further and become plasma cells. The plasma cells will make and secrete antibodies, and those antibodies will go off to fight that antigen-bearing agent. Antibodies combine with the antigen-bearing agent, and they help to destroy it. With T cells, the antigen-bearing agent enters the tissue, same thing. An accessory cell, such as a macrophage, will phagocytize that antigen-bearing cell. The macrophage will digest it, and then the antigens from the digested antigen-bearing agent will be displayed on the membrane of the macrophage. Helper T cell becomes activated when it encounters a displayed antigen. The activated helper T cell will release cytokinins when it encounters a B cell that is previously combined with an identical antigen-bearing agent. Those cytokines tell that B cell, activate, start dividing. Alright, some of those newly formed B cells give rise to cells such as plasma cells. Those guys make antibodies. Antibodies go and destroy the foreign invader. How do the antibodies work? So we get our antigen-antibody complex. They can neutralize the pathogen. They can cause the pathogen to be agglutinated, come out to form a clump. If it is something that is soluble, it can cause it to come out of solution, or it can work via complement, which will basically pop the cell. Neutralization means that there's antigens on the surface of the microorganism or pathogen that has come in, and it just covers it up so it can't interact with anything in your body. It just can't harm you. Agglutination, like we said, it'll clump it, and when it gets clumped, it enhances phagocytosis. Neutralization, that also enhances phagocytosis. Precipitation, once it's visible, now your macrophage can go eat it. Alright? And with our complement, that's going to help out with phagocytosis, inflammation, and cell lysis. Cytotoxic T cells are going to be stimulated by cytokines, and those are basically going to just kill off any virally infected cells. Okay, so we have an antigen. It enters the body. It passes through the innate defense. It gets through our surface barriers and our internal defenses. Now we enter the adaptive type response. A cell such as a dendritic cell or a macrophage eats that pathogen. Alright, when that cell eats the pathogen, it's now an antigen presenting cell. It can help activate naive helper cells. So it activates naive helper cells, or it can activate a cytotoxic T cell. The naive helper T cell can go in, it makes memory cells, and it makes more helper T cells. That activated helper T cell can now go off and activate natural killer cells. Once again, that antigen passes through the adaptive immune system. It comes through, it activates B cells. Alright, B cells proliferate and form plasma cells. B cells can also be activated via our helper T cells. Alright, Helper T cells come over here. They can also help activate cytotoxic T cells. When cytotoxic T cells are activated, they make more cytotoxic T cells, and they also make memory cytotoxic T cells. So the gist of it, helper T cells are going to help activate all the other cells, all the other adaptive cells of our immune system. Autoimmunity is basically when your body doesn't recognize its own tissue and it forms an immune response against it. It can happen either because the tissue changes and it changes its antigens, or it can happen because your body just lost track of what that antigen is supposed to look like, and it decides to start an immune response against it. Some examples are type 1 diabetes, rheumatoid arthritis, lupus, and multiple sclerosis. You just need to know a couple examples. Now, practical classifications of immunity. There's going to be 4 types here. You're going to have naturally acquired active immunity. This means it's naturally acquired and it's active. You got a disease, you've been infected with it, your body fought it off, you're cool now. Artificially acquired active immunity, your body has been infected with this pathogen artificially. So you got like a vaccine. They injected you with the antigen from the microorganism so your body can see it, and now if you ever get infected with it again, you get that secondary immune response. Artificially acquired passive immunity. This is injecting somebody with specific antibodies against a specific microorganism. They have an infection, their body's not capable of fighting it, they are injected with antibodies to fight that. Naturally acquired passive immunity, this is going to happen from mother to fetus. And mom can pass antibodies to the fetus in order to help the fetus to fight off a disease if infection occurs. And with our hypersensitivities, use this to fill in your study guide, and just take it for what it is.